People always ask me after all these years, why don't you retire and get a hobby? And it's kind of like, okay, what would I do that was be more interesting than what I do every day?
We got out of bed at 7 a.m. all the time in the old days because we were on 3 different committees for this hospital.
Yes.
Was it voluntary? I guess, but yeah.
You felt obliged.
We're privileged that we have jobs that we enjoy, that challenge us, that allow us to share what we know with people, share their lives with them, and I think those relationships you build over time are a lot of what keeps you going.
Mm-hmm. We were really lucky to practice medicine in a time where family physicians truly did the full scope of medicine.
I remember a C-section we did with a local anesthetic when the anesthesiologist showed up at the end of the procedure.
Right.
Literally. With a ruptured uterus.
Mm-hmm. And was that the one we did in the closet there? Because we did one in the closet with the ORs were all full, and right. We ended up having to do it in a closet that was a ruptured uterus, and we didn't have any other options.
The family docs back then were the hardest workers I've ever been around. I mean, they would deliver babies, go see their office patients, make rounds in the hospital maybe once or twice a day. So I was part of the foundation, I guess, of that group. We all kind of came at the same time, and we were here for the growth. Gary Brewer came in, what, 15, or actually almost 20 years ago. And when Gary came in, he's like the Louisiana cyclone. He came in and this place exploded. I mean, now we have cath lab. It saved my life. Frank Law saved my life. So it's pretty cool to work at a hospital where, you go to the cath lab and get your artery opened up, and you keep on working. You put it all together and look what we have. I mean, it's pretty phenomenal. We got a helicopter sitting out here. We got cath lab upstairs, cancer center, all the services we provide. I just got through talking to Dr. Kilnani. We got a pulmonologist on staff. I mean, it's pretty phenomenal, the growth that I've seen over the years here.
I always want to impart knowledge, and that way we all get better. The patient gets better. Our hospital gets, a great reputation. And so it's a two-way street. Never stop learning and never stop listening to other people. The moment you stop listening and you stop learning is a day you're not going to evolve as a physician.
The people in this community are lucky that the medical staff, the board, the nurses, all the people who work here have elevated to where we are today. We're not just a rural hospital anymore. We're a referral center.
Dr. Martin for me is huge, Travis. I mean, he just has made me being here feel really welcoming. He does a really amazing job of doing what needs to be done and doing the right thing for the patients.
My physician growing up was Mary Jo Jacobs, and I just have the best memories of her. I always wanted to go to the doctor because she was such a fantastic physician. And when I first came here, I worked at Mountain Family, and Crystal was an incredible mentor, and she's one of the reasons I so enjoyed my time at Mountain Family.
I think I mostly came back for family, I think, like knowing the community, and then even in Eagle, I know a lot of those people.
With this kind of community where you are interacting with your patients in the office or in the hospital, but you're also fellow members of the same community, and spending time with them outside of that clinical location is something, I think, to me that turns out to be very important and special, and probably had a lot to do with growing up here.
I came out to visit Glenwood Springs and to interview with Dr. Royal Smith in the winter of 1977 and 78. Dr. Smith and I actually purchased ourselves the first portable 2D ultrasound imaging machine. We ourselves purchased the very first CT scanner that Valley View Hospital had and put it in the department. Our seeds that were planted have grown, and we're seeing our visions materialize.
Dr. Smith was the greatest thing. He brought if you talk about mentoring, he gave me $2,000 so I could put a down payment on my house. He knew that if they got a surgeon, that the surgeon would order x-rays and do things that, they weren't doing them very much of. I mean, he was the best.
There are a lot of decisions made by the hospital that affect our patients. And we feel it's critical for us to be involved with that. If we truly care about how our patients are treated, then we need to be involved at the decisions at the administration and at the leadership level so that those decisions can be made with the best interest of patient care.
I think we're at a place in this hospital's history where we've really gone from being a small community hospital to offering some services that are really more consistent with that of a regional medical center. And the level of care that I think we're able to offer here, and the level of physician that comes here and practices here and cares for patients here, is really extraordinarily high.
I have learned so much from Joel. He's kind of like the most humble rock star in the operating room you can ever imagine. And so he's basically taught me how to do, you know, a life-saving hysterectomy in 5 minutes. And I think from his experience in Africa, that has benefited all of us.
What I love about Joel is I'll be like, there'll be something crazy that a typical OBGYN would never know how to do. I feel like there's almost nothing you couldn't handle.
But yeah, I think we're all learning from each other, bringing something new to the table.
We all have a similar philosophy in how we practice and really put the patients first, and whatever they need, we're willing to do and stay extra. And
yeah.
If you call me at 5:30 in the morning
on your
my
birthday,
I will come in like that.
Yeah.
Which we've all done. We've all called each other in for help.
Yeah.
You know, in the middle of the night. And
yeah.
It's great to know that somebody's always there for you.
I still think the best part is sitting down and talking to the patient, and spending time with them, and trying to understand not just what's causing this or that symptom. You got to figure that out. For me, that is sort of the easier part, to be honest with you, anymore. It's being empathetic and just trying to help them out. That's what we're supposed to do. That's what we do.
As Chief of Staff, I think one of the great tasks that I am really excited about is continuing to make this a hospital that is led by the physicians. And we have so many people who are so well trained, who are so thoughtful, and who care so much about this community that they volunteer to put themselves in positions to contribute in ways beyond patient care. I think that's really what is going to push this hospital into the future, is physician leadership, because that's how this place started, and that's how it's going to grow. That's how it's going to continue to become greater and greater for the benefit of our community members.